नमस्ते, म Dr. Kajan Ranabhat. म एज एन इन्टरभेन्सन रेडियोलोजिस्ट BNB अस्पताल र किस्ट मेडिकल कलेजमा काम गर्छु. वेलकम टु Dr. Vyasa. So basically, रेडियोलोजिस्ट भन्नाले रेडियोलोजिकल इक्विपमेन्ट्सहरू जस्तै हामीले बेसिकली थाहा भएको एक्सरेज, अल्ट्रासाउन्ड, सिटी स्क्यान, एमआरआई लगायत फ्लोरोस्कोपी मेसिनहरूको सहायताले रोगको निदान गर्ने चाहिँ डायग्नोस्टिक रेडियोलोजिस्ट भए. यसबाट अझै थप सब स्पेसियालिटी अध्ययन गरेर यही उपकरण युज गरेर अलिकति ट्रिटमेन्ट गर्ने रेडियोलोजिस्टहरू चाहिँ इन्टरभेन्सन रेडियोलोजिस्टहरू भनिन्छ. इन्टरभेन्सन रेडियोलोजिस्ट, इन्टरभेन्सन र रेडियोलोजी. इन्टरभेन्सन भनेको शरीरभित्र प्रवेश गर्ने र अल्ट्रासाउन्ड, एक्सरे, सिटी र कहिलेकाहीँ एमआरआई र धेरै जसो क्याथल्याब जस्ता उपकरण, रेडियोलोजिकल उपकरणको सहायताले बिरामीको शरीरमा एकदम सानो प्वाल बनाएर भित्र एन्टर गरेर कुनै पनि ट्रिटमेन्ट प्रोसिजर या कहिलेकाहीँ निदानात्मक डायग्नोस्टिक प्रोसिजर पनि गर्ने डाक्टर साहबहरू चाहिँ इन्टरभेन्सन रेडियोलोजिस्ट भनिन्छ हामीले. ओके, बेसिकली इन्टरभेन्सन रेडियोलोजिस्टहरू कसरी काम गर्नुहुन्छ भने इन्टरभेन्सनसँग सम्बन्धित रेडियोलोजिकल इक्विपमेन्ट्सहरू हुन्छ. त्यो इक्विपमेन्ट्सको गाइडेन्समा जस्तै अल्ट्रासाउन्डलाई गाइडेन्स या सिटी स्क्यानलाई या क्याथल्याब भन्ने हुन्छ, फ्लोरोस्कोपी, त्यसको गाइडेन्समा हामीले इन्टरभेन्सन रेडियोलोजिस्टहरूले शरीरमा प्रवेश गर्छौँ र विभिन्न निडल या पाइप्स या क्याथेटर, वायर्स भन्ने उपकरणहरू हुन्छ. त्यसको सहायतामा जहाँ प्रब्लम छ, जुन अर्गानको जुन रोगसम्म जानुपर्ने हो त्यहाँसम्म पुग्नलाई चाहिँ रेडियोलोजिकल इक्विपमेन्ट्सको सहायता लिन्छ. त्यसपछि ट्रिटमेन्टको लागि चाहिँ विभिन्न उपकरणहरू त्यहाँसम्म लिएर गएर ट्रिट गरिन्छ. सो यसलाई साधारणतः मैले दुई भागमा डिभाइड गरेँ भने एउटा भास्कुलर इन्टरभेन्सन जुन चाहिँ रगतको नलीबाट भित्र जाने, यो भास्कुलर इन्टरभेन्सन भयो, र अर्को चाहिँ छालाबाट डाइरेक्ट त्यो अर्गानमा छिर्ने, त्यो चाहिँ नन भास्कुलर इन्टरभेन्सन. यो दुई प्रक्रियाबाट इन्टरभेन्सन रेडियोलोजिस्टहरूले काम गरिरहेको हुन्छ. स्ट्रोक भन्नाले यसलाई नेपालीमा भन्दाखेरि मस्तिष्कघात या पक्षघात भनेर बुझौँ. स्ट्रोकमा चाहिँ साधारण हिसाबमा भन्नुपर्दा जे हामीले हृदयघात या हार्ट अट्याकलाई बुझ्छौँ त्यसरी नै ब्रेनमा हुने घात मस्तिष्कघात स्ट्रोक हो, या यसलाई ब्रेन अट्याक भनौँ. सो यो ब्रेन इक्विभ्यालेन्ट अफ हार्ट अट्याक भनौँ न. सो स्ट्रोक बेसिकली के हुन्छ भने हाम्रो ब्रेन सेल्सहरूमा लगभग 22 अर्ब कोशिकाहरू हुन्छ अनि यसको आफ्नै रगतको सञ्चार हुन्छ. जब यो रगत सञ्चार बन्द हुन्छ या ब्रेनलाई सप्लाई गर्ने रगतको नली कुनै पनि हिसाबले फुट्छ र रक्तस्राव हुन्छ, यो दुई कन्डिसनलाई हामी ब्रेन अट्याक भन्छौँ. सो ब्रेन अट्याक 81 हुन्छ. हार्ट अट्याक भने जस्तै ब्रेन अट्याक पनि 81 हुन्छ. यसमा आइदर प्राय जसो 80% नली बन्द भएर ब्रेनको टिस्युले रगत पाउँदैन र मर्न थाल्छ. रगत नपाएको 3 मिनटदेखि नै मर्न सुरु हुन्छ. अर्को खालको ब्रेन अट्याक भनेको चाहिँ ब्रेनको नली फुटेर, अब यो फुट्ने विभिन्न कारणहरू हुन्छ, जुनसुकै कारण भए पनि ब्रेनभित्र हेमोरेज भयो, ब्रेन हेमोरेज जसलाई भन्छौँ, त्यो पनि अर्को टाइपको स्ट्रोक हो. सो बेसिकली यो दुईटा ब्रेनमा हुने इन्सल्ट, मस्तिष्कमा हुने घातलाई चाहिँ मस्तिष्कघात या स्ट्रोक भनिन्छ. एकपटक स्ट्रोक भएको पेसेन्टलाई यदि ट्रिटमेन्ट पाइएन भने पुनः स्ट्रोक हुने सम्भावना छ र लाइफ टाइम रिस्क चाहिँ पहिलो 28 दिनदेखि 1 वर्षसम्म मोर्टालिटी जुन मृत्यु दर भन्छौँ हामीले बाँकी पपुलेसनभन्दा 5 टाइम्स हाई भन्ने चान्सेस छ। यो भन्दै गर्दा तर ट्रिटमेन्ट पाइयो भने कुन समयमा पाइन्छ भने स्ट्रोक भएको अनसेट, स्ट्रोकको सिम्पटम पहिलो देखिएकोदेखि कति आवर्स बित्दासम्म स्ट्रोकको ट्रिटमेन्ट सुरु भयो भन्ने चिजमा डिपेन्ड गर्छ। जति अर्ली हामीले ट्रिटमेन्ट गर्न सक्यौँ त्यति बाँच्ने सम्भावना या पक्षघात हुने सम्भावना पनि कम हुन्छ, प्यारालाइसिस हुने सम्भावना पनि कम हुन्छ। स्ट्रोकको उपचार बेसिकली मैले अघि भने एउटा चाहिँ हातको नसाबाट दिने औषधि र अर्को चाहिँ मेकानिकल थ्रोम्बेक्टोमी। यो थ्रोम्बेक्टोमीमा चाहिँ हामीले सर्टन डिभाइसेसहरू हुन्छ जुन चाहिँ ब्रेनसम्म लिएर गएर त्यसलाई तान्छौँ। एउटा चाहिँ एस्पिरेसन भन्छ जुन चाहिँ भ्याक्युम लगाएर हामीले त्यो क्लटलाई तान्छौँ। अर्को चाहिँ एउटा जालो स्टेन्ट हुन्छ जुनमा अल्झाएर त्यो थेग्लोलाई हामी बाहिर निस्कायौँ। सो यो इक्विपमेन्टहरू जुन यति हाइली प्रिसाइजली इन्जिनियर्ड छ, यसमा लाग्ने बनाउँदाखेरि लाग्ने सामानहरू पनि महँगो छ। सो यो डिभाइसेसहरूले गर्दा यसको ट्रिटमेन्ट महँगो नै छ। अधिकांश हाम्रो इन्सुरेन्स सिस्टम नभएको स्टेजमा आउट अफ पकेट इमिडिएटली 81 हामीलाई यो ट्रिटमेन्ट गर्नलाई अलिकति गाह्रो पनि हुनसक्छ। See, drinking water and stroke prevention has not been directly linked. Drinking water is a good habit in itself. Drinking adequate water is a healthy lifestyle. Water helps maintain physiology in so many ways. That's an understood fact. But just like drinking water right before bed is not directly linked to beneficiary effect in prevention of stroke or heart attack. We don't have any direct evidence on that. On top of that, if you drink water before bed, हामी सुत्नु अगाडि पानी खान्छौँ र त्यसले गर्दा हामीलाई राति उठ्नु पर्छ, त्यसले हाम्रो स्लीप साइकल बिगार्छ. If drinking water wakes you in the middle of the night just because you have to go to restroom and that disturbs your sleep cycle, that would be detrimental instead. किनभने sleep cycle is very important for our body to rejuvenate. If sleep cycle breaks, the rest of the day we probably have felt ourselves it's stressful. Stress is directly linked to stroke. So drinking water right before bed, you have to be careful. Like we don't want to break our sleep cycle. Well, a chain smoker versus non-smoker. If I have to compare, obviously the risk factor of the smoker is highly increased. See, a person who smokes a pack of cigarette a day, his chances of getting stroke increases to 5 to 6-fold than a normal non-smoker. Having said that, a chain smoker is definitely going to have higher chances. But then the thing is, you have to compare a person who smokes to the same person who doesn't smoke, actually. Like if I smoke, what are my chances of having stroke? And if I don't smoke, what are my chances of having stroke? That should be the better comparison, because we have seen persons smoking a lot, living up to 80s or his 90s, and a person who doesn't smoke dying early because of stroke. So the comparison should be within the individual. If an individual doesn't smoke, his chances of living longer is way like 5 or 6 times larger than if he smokes. The comparison should be that, because that takes into account your genetic makeup, how your body responds to cigarettes. So definitely smoking is linked to disruption of your lipid metabolism. Smokes makes your blood vessels stiff, non-expansible. These all are directly linked to having myocardial infarction or heart attack or brain attack. So definitely smoking is not good. A young individual who's physically active and apparently well have died from stroke in their early age. That's why I said apparently healthy. So what's going on inside, many a times I don't know. I am physically active. I seem to be apparently healthy, but there are so many things that I don't know until I get myself checked time and again. Because say blood sugar, blood pressure, they don't manifest at their earliest. हामीले यसलाई मैले मधुमेह प्रेसरलाई मेरो एकजना प्रोफेसरले भुसको आगो भन्नुहुन्थ्यो कि भुसको आगो भनेको भित्र बलिरहेको छ आगो, बाहिरबाट हेर्दा so intact, but by the time you see it from outside, it's too late. So your diabetes, hypertension भन्ने चिजहरू कहिलेकाहीँ apparently थाहा हुँदैन. We are physically active, we're doing everything seems so good, but then time and again you should get checked up. One thing is that. Another is your genetic makeup. As I said earlier, some genetic predispositions are there which makes you more vulnerable. Like I said, hemorrhagic stroke, the underlying basic, one of the most common cause of hemorrhagic stroke, of brain hemorrhage, is aneurysm. Aneurysm is just an outpouching from weak portion of your blood vessel. So it might have been there since your childbirth, or you might have developed it, but then you don't know until you get a CT angiogram done, or you don't know until you bleed, until it ruptures and then you have blood in your brain. So until it has ruptured, apparently a person is healthy. So who gets an aneurysm, who does not, is many a times determined genetically. So sometimes even healthy people, they land up in our emergency with stroke. Coma is a Greek word. Coma means a state of asleep. So as we see in movie, what doesn't happen in coma is the person is not in sleep. We don't know a comatose person is even dreaming or not. Actually, the brain works, they don't even have REM cycle. That means they don't have the sleep the proper sleep cycle. So what exactly happens in coma is your brain doesn't generate that amount of activity like a normal brain does. Brain in comatose patient is working at a very basic level. So actually what is brain doing is, I would like to mention in this way. Let's say a conscious brain has two factors. A brain is awake and the brain is aware. Awake means you use your reflexes to respond, and aware is how you respond to whatever is going to your surrounding. Like being aware is knowing where am I, what am I doing, who are surrounding me, what's going on. And awake means I can respond to any stimuli. So a comatose brain either doesn't have awakening or awareness or both. So it's the disruption of consciousness. You may compare it to somebody who has been general anesthetized. Like before somebody goes to surgery, the anesthetist paralyzes you. That anesthetized person is not awake and is not aware. So coma is something like that. Yeah, donating blood and prevention of it's an interesting question actually. Donating blood, I see it this way. Firstly, as I mentioned earlier, stress is directly related to stroke. Donating anything gives you good feeling. And whenever I have donated blood like more than 15 times. Every time I get this good feeling, you can link that to reducing your stress. Like donating is a stress buster, definitely. Well, scientifically, donating blood, what does it do is you donate blood, it's replenished. So a fresh gush of blood comes into your circulation. Transiently, it thins your blood. It's like using blood thinner. One of the medications we use in stroke is blood thinner. You want to keep your blood thin so that wherever there is a narrowed passes in your blood vessel, as the thick blood traverses it, there's a chances of the blood getting clot. So that's why we use blood thinners in treating, preventing strokes. In a way, though transiently, blood donation helps this way. So I don't know in figures, but I think there's a beneficiary effect of donating blood time and again. So in the end, thank you to the entire team of Dr. Vyasa for inviting me to the show, and definitely subscribe to Vyasa Media Network for more.